Right there.
Yeah.
Right there. Right there. This is like a really bad one.
Yes, you nailed it, Doc.
Hey everybody, it's Dr. Wellwood here, your local Spokane chiropractic physician, and welcome to the clinic. Today I've got a really cool treat for you guys. It's actually a local high school teacher who came in here because his medical doctor had diagnosed him with an acute herniation. And so he went to his doctor, he got an MRI, they want to do some surgery on him. He doesn't want to do surgery because he's an active individual, so he came into the office to get treated. So the video you're going to be seeing is me treating him as well as kind of going through with you guys what it exactly is that we're looking for. It's a little bit longer than I have done in the past, but I promise you're going to enjoy it and you're going to learn a lot. So sit back, relax, don't forget to subscribe to the channel and like the video.
So we have a patient here today who's coming in with acute lower back pain. And he came in yesterday and he felt about 10% better. His pain relief lasted only about half an hour, you said, Aaron?
Yeah, half hour, 45 minutes.
So half hour, 45 minutes. So what that means is that oftentimes when a person comes in with that much pain, they're having difficulty coping with the inflammation that's being produced in their system. For him, he's got a lot of inflammation along the spine, and then he's also got some muscle spasticity and some rigidity. So he's basically not moving very well. Yesterday, he had a lot of puffiness and inflammation, and when we adjusted it, it went immediately away, and he was able to walk out without having much difficulty. So we're going to look along his spine right now and just kind of see if there's any muscle issues that are going on, as well as if there's any inflammation. So, you ready?
Yes, sir.
So what I'm doing is I'm just going ahead and pushing along his the ligaments in between his vertebra there. This was okay yesterday. Now we're kind of getting in the icky areas. So there's a ligament right there.
Yeah.
That's the one.
That was one of them. That's one.
Right there too.
Yep.
And that's right there too.
Yep, that's one too.
So what I'm looking at is I'm looking at this refill, this capillary refill along the side. So you push along this here, and you can see how slow it goes. And that means there's a reduction in perfusion. So there's not getting a lot of oxygen in there. We're going to check the other side as well. You can see this one's actually quite a bit slower over here. And over here as well. So you can see how long that one actually took. If you blanch it out, and is actually causing pain right now. This is the ligament in between.
Yep.
I don't know if you can see that, but you can actually see a little bit of puffiness right through here. So that's what we're dealing with. So we're going to go ahead and see if we can get that moving and provide him with some relief today. Right there.
Yeah.
Right there. Right there. This is like a really bad one.
Yes, you nailed it, Doc.
Yeah. So what I'm going to do is I'm going to put my fingers on both sides. You can see just from the blanching how slow his refill is in there. And you can actually feel this vertebra sticking out over here.
Yes.
This one over here.
Yep.
So the ligament that's holding that vertebra that's straight and this vertebra that's over here is twisted and it's causing a lot of pain when you just push a little bit on it. You notice I'm really not pushing very hard. So, all right. What I'm going to do first, I'm going to basically relax his muscles down here, and then we're going to use a machine to kind of move things along. That's going to help reduce some of the muscle spasms and also start to increase the blood flow to the area. So we're going to use the percussor. I'm going to start off where it doesn't hurt so much. You doing okay?
Yeah, it feels good.
Feels good.
Oh, it feels good.
Now the percussor is pretty nice because it actually provides a lot of relief for the patient very quickly, especially if you have a disc issue like he does. He's actually got a mild disc bulge and they wanted to do surgery on him, but he can't take a lot of time out So he's opting to do natural chiropractic care instead. Doing good, Aaron?
Yeah, it feels really good, Doc.
Okay, good. So you can see I'm getting each one of the little spots that are a little bit puffy, and because I want to kind of squish the tissue out and I want to create that blood flow. Is that feeling better now?
Oh, Doc, big
Good.
time better.
Good. So yesterday after his visit, I told him to increase his water intake as well as to increase motion. He feels really good when he's moving. And that's a good indication you have a lot of inflammation between those joints in there. There's a point where it becomes too much motion though. So when you're walking after this type of thing, you do really need to make sure that you're walking comfortably to and from the area that you're going to. What we see here a lot is that patients tend to overdo it. And when they overdo it, they get about halfway there and it starts to cramp up on them. If it starts to cramp up on them, then we're having a problem. Good. Doing good?
That feels really good, Doc.
Good. So we know he's got a disc issue because he's got a, we've got an MRI that actually shows that he does have a disc issue, but there's a big misnomer out there that discs actually cause pain. It's not true. It's actually the inflammation around the disc that's actually causing the problem. And when the inflammation goes so much, it actually puts pressure on that nerve a lot, and then the pain goes outward down the leg, and that's called peripheralization. So when you tend to get better with treatment, the peripheralization goes from outward down the legs and actually goes towards the area of pain, and then that's called centralization, and that means the inflammation's gone down so much that you're almost ready for stabilization exercises. Doing okay?
Yes, sir.
Let's go ahead and do the, we're going to go ahead and do your arthrostim now. It's a mechanical type of adjusting. We're going to be doing this because I want to make sure that we get each one of those vertebrae moving very well, and we want to increase, again, local blood flow. How's that feel, Aaron?
That feels good.
Feels good. So this little sucker is nice because it actually moves the vertebra back and forth over and over and over again. And if you can see, put my hand right here, that's how much it's moving, which is a lot. And that's a lot of motion being put through this, this very swollen disc in here. Is that feeling better now?
Yes.
How's the leg pain?
Oh, it's dissipated.
Good. So he says the leg pain's dissipated, so it's gone down, which means that we're doing our job.
That one hurts a little bit.
Okay, so we're going to leave it right there until the pain starts to go down, okay, Aaron?
Alright. It's getting better.
Good. So sometimes when the pain gets really bad, or if the vertebra's stuck, it feels sharp and stabby at times. And then once we keep the adjuster on there and the vertebra starts moving on its own, then we know that the pain starts to go down as well, and we know that we can move on to the next section. How's that one, Aaron?
That's good.
Okay. How about that one?
Oh, that one hurts.
Okay, so we're going to keep it right here for a second.
A little better.
Okay. I'm going to bring it up here. How about that one?
That one's good.
Okay, good. So we still got a little bit of inflammation right through there.
Oh yeah.
How's that pain now?
A lot better. It is definitely decreased, probably 60–70%.
That's great.
Yeah.
Okay, so I still feel.
Oh yeah.
So there's that rotation.
Oh yeah,
still.
yeah. That one hurts.
So it's still got a little bit of rotation on there after the machine and after the percussion. So we're going to go ahead and do a manual adjustment on it. All right. You okay?
Yes, sir.
Go ahead and lay on the side over here for me.
Okay, so we've positioned them on the side that the vertebra is actually rotating towards. So I'm actually going to push it downward. And when we push it downward, you might hear a big pop, you might not hear a big pop. What you need to make sure is that your leg is actually appropriate. So what we tend to do is we lock the leg, and then we move the vertebra back and forth. And we're making sure that we get that very specific section right there. So I'm going to scoot you forward a little bit here. Good, I'm going to take this here, there, here, hold it right there, right there.
Oh!
Yep. Take a breath, let it out.
Oh! Oh!
There we go.
Oh! Oh!
You okay?
Yes.
All right, good. All right, let's go ahead and see how it feels now.
Oh.
Good. How's it feeling so far?
A little better.
A little bit better?
Yeah.
Okay, let's go ahead and get the one above it.
All right.
So I'm going to bring your leg way up in here.
Right.
And bring it down here like that.
All right.
Good. Here. Now I want you to resist. So I want you to push your knee down as hard as you can into my leg.
Ah!
There we go.
Ah!
There we go.
Ah!
There.
Ah!
Good. Now let's check it out. How's it feeling?
Better.
Good.
Yeah.
Had to go kind of far up there, didn't we?
All right.
Go ahead and lay in the back. Let me get a couple more areas there.
All right.
Good. Give yourself a big loving hug.
All
A little bit more love. There
right.
you go. Good. Breathe. Good. Yeah. So he's got a weird curve down there, so I have to bring him up a little bit further. So take a deep breath in. I'm gonna put you up on my hip, okay? Good. Take a breath. Let it out.
Oh,
There it
good.
goes.
Oh, that was good, Doc. Oh, that was good.
Think we got that one?
Yeah.
You felt that sucker clunk really good in there.
That was good.
Yeah. That was good. You look a little red now. You feeling okay?
Yeah, feeling good. Wow.
You want to see if you can stand up for me?
Oh, yeah. Wow. Yeah, a lot better.
Is that better now?
Yeah. Yep, a lot better. Yeah, a lot better. If pain was a 9, it's probably about a 2 or a 3 now.
Awesome.
Yeah. A little bit of the pain down the right leg.
Okay.
But the back feels good.
Back feels good?
But the right leg hurts.
Does the right leg pain feel different than it was before?
No, it's about the same kind of pain.
Okay. So let me see where it is then.
It's right down through here.
Okay. Ah. Okay. So go ahead and lay in the back for me.
All right.
So he's saying that he actually has pain down the hip now. And oftentimes when you have a disc issue, the muscles cramp up. So we're going to see if...
That's it, Doc.
You think so?
Yep.
We're going to see if we can alleviate with some of that with some stretching. So go ahead and put this one down for me.
All right.
And then bring this up like that. Ah, there it is. You feel that one right there?
Yes, sir.
Yeah.
Yep, that's it. You nailed it, Doc. That's it.
Good. Now push out.
Push out.
Towards me. There you go.
All right.
A little bit less.
A little bit less. All right.
Do it again. That's better. Nice and slow. When you're doing these types of stretching, slow is actually quite a bit better than going fast. You want to make sure that you get through that entire muscle group. Go and push out. There you go. You can breathe. You weren't breathing, buddy.
My wife has to remind me to do that.
Push out. There you go. You can feel how weak that is?
Yes.
So keep pushing. There you go. I'm going to bring a different muscle group here, here, and here. Now push more like this.
All right.
Go ahead and push. That's better. So the different angles are different muscles.
Interesting.
Push straight out. There you go. See how it's kind of bumping around a little bit?
Yep.
That's a good indication it's been going on for a while.
Yes, sir. You nailed it.
Push out.
It's been pain for like 2.5 months.
Now, push out. Alright.
That's good, Doc.
There you go.
Oh, that's good. Oh, that feels a lot better.
Want to sit up for me and see how it feels now? Make sure you can.
Oh yeah. Yeah, much better. Much better.
Was that it, man?
Wow, yeah. That's a lot better.
So we got that little extra
Yeah.
muscles in there and I feel better.
Yeah.
Good.
Wow. Woo.
Is there pain down the leg anymore?
Let's see here. Nowhere near where that's been. There's a little bit. I mean, you can feel it, but nowhere near like it was.
Good.
Yeah.
Good. Your pain level right now?
Pardon?
What's your pain level right now?
It was an 8 or a 9. It's probably a 2 or 3.
Wonderful.
It's like a dull pain, but not the sharp.
Not the sharp stabby stuff.
No, not the sharp stabby stuff.
Okay.
Doc, you rock, man. Thank you. Woo!
All right. I love it. Now, again, walk. Water.
Water.
All right.
Ice.
Ice. And make sure it keeps feeling good, okay?